Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we are taking your calls and questions at 866-870-5752. That's 866-870-5752. If you're just joining the program, we talk here about musculoskeletal pain. That's knee pain, hip pain, back pain, neck pain, joint pain, muscle pain, disc pain, ligament pain, anything that is part of the structure supporting the body. That is Dr. Darrow's specialty. So do give us a call. Get your free book, Stem Cell and Platelet Therapy, with over 264 studies. And remember, we are halfway through the program right now, and do not wait till the last minute to call us because we want to have time for everybody. So call right now, 866-870-5752. Dr. Darrow, do you want to talk about some other things going on in the office?
Yeah, absolutely.
Like ideal protein, maybe?
Sure.
To get that weight off the knees?
Yes. Unfortunately, extra weight on the knees can cause arthritis. I know you don't want to hear that. We have a diet that's called ideal protein. I checked around for a lot of different diets, and I found one that I love, which is called Ideal Protein, and I tried it for a week and I lost 7 pounds, and I'm pretty skinny as it is. I'm about 6 feet, 170 pounds. So it can do wonders for you. I have people that come in that are 50 to 100 pounds overweight. We get them to lose their weight, and guess what happens with that? The pain in the lower extremities decreases. We do it at the same time that we're doing the injections, which is an incentive for you to really stick to the diet because you know you're doing a procedure to help heal your joints. So please don't get mad at me if I ask you if you're interested in losing weight. If you don't want to, I tell you I'm going to shut up. But if you want to, we'll help you do that. And I think that's pretty magical. Every pound on your tummy in excess is about 4 pounds extra on your knee. If you are 50 pounds overweight, 50 times 4 is 200 extra pounds on your knees every time you stand up. So think about that and think about what you can do. You can start right now by cutting out your carbohydrates, but most people don't like to do that. This diet's real simple. The other thing I'd like to talk about is my wife, Michelle Darrow, and the procedures that she does as a nurse practitioner, which is aesthetics, meaning to make faces pretty and to grow hair on the head. She does the same work I do. She'll take cells from your body and inject them into the face, called a vampire facelift. You won't forget that name. No surgery, no knives, just injections. It takes a few minutes, and you walk out and the collagen starts regrowing in the face. So I think that's a really cool thing to do. So, absolutely. Yeah.
Okay, so I'll give the phone number again, 866-870-5752. That's 866-870-5752. Remember, if you're in chronic pain and it's musculoskeletal pain, maybe this is your day to begin to live pain-free. That is the name of the show, by the way. No coincidence there. Living pain-free. That's what we want for everybody, right?
Yeah, and our byline to the show is take the surgery out of pain. That means if you have pain, it doesn't mean you need surgery. And just because your MRI says you do, doesn't mean you do. And if I may move on right here, Anita, this is the second part of this question that had just come in.
Sure.
About knee pain, bone on bone. So, I mentioned that bone on bone doesn't mean a thing, so don't get suckered by that term. Person then says, my condition is getting to where any long distance walking or weight bearing, I limp considerably, and the pain has recently gotten noticeably worse. I can bring x-rays taken last summer and have an old MRI of one knee that is quite descriptive. And in parentheses, he says, I was a workers' comp lawyer and read the MRIs. I've done that for 20 years. Mine is the longest I've ever read, on parentheses. Would you care to give me a look? And he says, thank you. Well, of course I would. I'd love to look at it. But the first thing I'd like you to do is throw away that 20-year-old MRI, or however old it is, because it doesn't tell me a damn thing. Excuse me, darn thing. Did they bleep me? So
No. They'll forgive you.
it's nice for you to be God and you can forgive.
That's
so, yep. A lot of people don't know that God is a female.
Well,
The We Too movement brought that up, right?
yes. Well, we don't want to go political here. We want to solve people's pain problems. So let me just give the phone number a quick minute here, 866-870-5752. The hour is ticking by. Join the conversation now, or you will wait in line and we'll run out of time. So sad.
Yeah, please call us now.
870-5752.
Don't wait. But anyway, the point is this. This guy is a workers' comp lawyer. He knows how to read MRIs. And he's got one of his own knee, which I'm going to tell him is worthless. I want to look at it, but it doesn't tell me where pain is coming from. It doesn't tell anybody where pain is coming from. Because if we were to take an MRI of our entire body, we would find anatomical issues. But it doesn't mean we would ever know that there was an issue. We'd live our whole life and never have an issue, never have a problem. So be careful not to get a surgery based on your MRI. And this poor guy thinks he's got a problem because his MRI shows it. Well, I say boulder dash.
Great old word. Love it.
Yeah, that's it. Why don't people use it anymore? It's a good one.
I don't know. Too many syllables, maybe. I'm not sure.
Yeah, I guess.
Well,
They use shorter terms now.
Yeah, well, we can't say those words on the air. Should we go
No.
to Bert in Camarillo?
Yes, Bert, it's Dr. Marc Darrow. I understand you had knee surgery and you still have pain. I'm sorry. When was your knee surgery?
That is correct. Left knee, lateral meniscus tear. I had the knee surgery, did all my rehab as I was told to do, and may have been a little aggressive on my rehab at times, but no impact. Did a lot of swimming. My diet is about as good as it can get, very natural. Nevertheless, my pain is coming down the stairs, going up the stairs, standing up. I'm 190 pounds, 5'11". My right knee I had surgery and it's solid, no pain. My left knee, I wish I never had the surgery.
Well, join the group. I had one on my shoulder when I was in medical school doing orthopedic surgery, and I loved my boss, who was my surgeon, and my arm ended up after the surgery as big as a balloon full of fluid, and I had a high fever. And it took me a couple of years for that to settle down. I then learned about regenerative medicine. I injected my own shoulder. This is going to sound funny. My wife was laying in bed watching TV. I jumped in bed, pulled out a syringe, injected my shoulder with her screaming at me, and I woke up the next morning. Honestly, I woke up the next morning completely pain-free. Wow. And it was the miracle of all miracles for me. After that, I knew this was going to be my profession. I started begging patients to allow me to try this new thing. And lo and behold, it's worked on most of my patients. It doesn't work on everybody. And I think the reason for that is people quit too soon. They may do it once or a few times and say it didn't work when it might have been that next time that did the job. Everybody heals differently. But I have a medial meniscal tear in my right knee, pretty big one. I've seen it on ultrasound. I injected it with stem cells, and I'm going to go out and play golf after this show. What does that tell you?
Wow. So it doesn't.
I didn't have surgery.
If the tear is there,
no, means nothing.
Between the joint, it's
no, it means nothing because no, we do studies on people all the time who have no pain, and guess what we find in their knee?
A tear.
Yeah, we find tears all over the body. It doesn't mean they cause pain.
Gosh.
Some are massive. You go, how do you lift your arm up? That whole rotator cuff is ripped. Well, apparently it doesn't mean much. It can, but it doesn't have to. And so what we try to do is stay conservative. That's the biggest point in medicine. Always be conservative. Stay away from surgery if you can help it. Some surgeries are emergency and need to be done. You have a broken bone, something like that, or cancer surgeries. I had a cancer surgery. Probably saved my life. But when it comes to orthopedics, most of these surgeries should not be done. I'm sorry. And it's not a statement against the surgeons. I love the surgeons. They're the hardest working guys. They're in a dangerous field, and they really put themselves out. So God bless all the surgeons. It's just that our culture has moved them to doing a lot of unnecessary surgery, and it shouldn't be done. And the day will come, hopefully during my lifetime, when we look back and we go, why did we let them do these surgeries? They were hurting people more than helping them. Because I get people in almost every day that have had failed surgeries that made them worse. You're not that bad. You had the surgery and you have pain still. But, it happens a lot of times where joints get destroyed.
Will this work on my lower back as well? Or because I do have pain?
Well, I'd have to touch it to let you know. Yeah, I heal a lot of low backs and necks and middle backs. How many? I guess I'm understanding these are injections, and how many injections are needed and spaced over how much time? Well, you need at least one. I don't know the answer. I'm being facetious. Okay. A lot of people heal with one. I've healed with one on some parts of my body. That shoulder injection, I did a series of injections, like a bunch of pokes at one time, and that healed overnight. And then the next time I injured my shoulder was 12 years later. That took a series of 2 times, and then it healed. And the most recent one was about 2 years ago, and it was from hitting golf balls incessantly every day. I get so addicted to sports. And that one took about 9 months to heal up. I had a frozen shoulder, and I was able to move it to do injections, around the waist level, but I couldn't lift my arm up at all. And that's fine. I mean, my shoulder, I'm lifting it right now as we're on the radio. I don't even notice that it's there. It's perfect. Wow. So, these injections work to me magically. And it's been a savior of my sports life, and it's gotten rid of a lot of depression in me, because when I can't do sports, I'm pretty miserable.
And I can relate to that, Dr. Darrow. So how do I find out how to get further on this? Do I contact
the 2 things.
LA office?
Yeah, there's 2 things. One is write down 800-300-9300. 800-300. No, 800-300-9300. And then write down the website so you can watch me inject some shoulders. Okay. That's www.lastemcells.com. lastemcells.com. It's got all the information there. You can get a copy of my book, Stem Cell and Platelet Therapy. Byline is Regenerate, Don't Operate. And it's got 264 studies on why you don't want to do surgery and why you do want to do regenerative medicine. The paradigm is switching around now. Less people are doing surgery, more people are doing regenerative medicine. The time will come when surgeons are not doing these surgeries anymore. It's just a matter of time.
That's terrific. Thank you very much, Dr. Darrow. I really appreciate it, and I will peruse your website and
thank you. There's good hope, Bert, that your knee is going to heal with regenerative medicine. By the way, you used a word that I used to use when I was a lawyer, peruse. What is your background?
I'm a retired firefighter paramedic, and my hobby is surfing and reading. I love to read.
Oh, excellent. Well, good for you. Excellent. Hope to see you out in the water someday.
Terrific. Thank you, Dr. Darrow. Appreciate your time.
All right, God bless you, Bert.
Thank you, Bert. Well, our number is 866-870-5752, and you still have a few moments to call in and speak to Dr. Darrow. Again, that number is 866-870-5752. Give us a call right now. The minutes just keep ticking away, Dr. Darrow. I don't want to miss out on people.
I hear you on that one. It's a shame that with Bert's knee, he had a failed surgery. And there are diagnostic codes that insurance companies have called failed surgery, failed back surgery, failed whatever. What does that let you know, Anita?
Well, it means the surgery failed, and it means the surgery was not perhaps needed in the first place.
That's true. And wow, the calls are really coming in now.
I know.
And it means that there are so many failed surgeries that the insurance companies had to make a diagnostic code for it. That's the big point.
Exactly. Well, how timely. Let's go to Bill, who just had the same issue. Bill in Los Angeles.
Bill, I'm so sorry. This is Dr. Marc Darrow. You had 4 surgeries on your knee and you still have pain. Tell us about it.
Hi, Bill.
Yes,
Bill.
and yes, I have terrible pain, and I'm going to have another surgery on July 17. It will be 5th surgery, same knee.
Bill, I want to be nice to you. When are you going to wake up?
What did you say?
It's not working.
What?
Why don't you think of something else besides surgery?
I don't know. I don't know what to do.
Well, we're going to wake you up right now. So write this down. 800-300-9300. It's my office number. Call and ask about how we can... Sure.
800.
800-300-9300.
9300. Okay, I'll call.
And then write this down. Write down this website, lastemcells.com.
LA Stem Cells. How to spell Stem? LA Stem STIM?
I'll give it to you. Hang back and write. LASTEMCELLS.com.
CELLS. Okay.
And look at that website, and you just add a www dot in front of it,
Okay.
and you'll
so
see
LA
all the information you need.
Correct?
And call the office.
Yeah.
Okay.
Thank you, Bill.
Okay. And
God bless you, my friend.
Okay, we're going to go right to Elena in Oak Park.
Hi there.
Elena, you have bursitis. This is Dr. Marc Darrow. How are you?
I'm good, thank you. Yes, I've been diagnosed with bursitis. My grandmother had it. My brother has it. And he's a little younger than me. Just found out he has it. And I've had it in several joints, my elbow, my knee, and most recently my hip. And it seems to go from, one joint to another. Like I'll be fine for maybe a couple months, and then all of a sudden I'll have a flare-up in my elbow. And then it'll be fine, and it'll flare up in my hip. So I was
Okay. You need to see what's called a rheumatologist.
Oh, even for bursitis. I thought that was just arthritis.
How do you know it's bursitis?
Oh no, I've been to several doctors, and it's said that it is bursitis.
So when do we decide that doctors know everything?
Well, they x-rayed it on each of the joints, and that's what I've been told.
Sure. You need to see a rheumatologist.
Okay.
RHEUM. Rheumatologist.
Okay, and see what they
They need to take your blood. Yeah, because that's unusual that it moves around like that. It could be an autoimmune type of thing that's going on. You may need to change your diet to an alkaline diet to get rid of that. I might be able to help you.
Okay.
I'd have to examine you and touch the areas and see what's going on.
Okay, and so more alkaline diet is good for that. Any inflammation.
Oh yeah, alkaline diet's good for everything. We're all very acidic.
Okay.
And the acid causes pain and breakdown in the joints, and inflammation. So take this down. The phone number is 800-300-9300.
Okay.
And you can call in and see if we take your insurance. And I must give you a caveat here. The insurance doesn't cover regenerative medicine in most cases.
Okay.
It covers your initial office visit and a few other things I do. So at least you'll find out what's going on. But you need to find a rheumatologist and get your blood drawn.
And then I just had one other quick question, and I try to listen to your show to see if anybody else has asked this, but cholesterol that's borderline high or getting higher each time I go in the doctor, are there any natural treatments? Because the last time she said she'd like me to go on to Lipitor or one of those medications if it continues to rise. So, I'm trying to control it with my diet, but what about any supplements?
Well, this is again, I don't want to point fingers at doctors, but it's already been disproven that cholesterol has anything to do with heart disease. Mm-hmm. So I'm not sure why anyone's given anybody Lipitor. Okay. Lipitor, to me, is the worst medication on the planet.
Yeah, I've heard that.
It causes all kinds of neurological difficulties. It causes, guess what? Joint pain.
Oh boy, I don't need that then.
So I would personally stay away from that unless your cholesterol is so skyrocketed high, but you've already told me that it's borderline. There is no such thing. That's already old medicine. I don't want to know why doctors are listening to the drug companies.
Mm-hmm. Yeah.
Drug companies are there to sell drugs. Doctors should be above that.
I agree. Okay, well, I was just curious if there was anything else I could be doing.
Well, you don't need to do anything. You need that cholesterol. It's the backbone of every cell in your body. You drop it down, there's depression that comes with it. And guess what? People that take Lipitor have less heart attacks, but they die at the same rate as people that don't take it. So it does absolutely no good at all.
Wow. Okay. Well, thank you.
The death rate goes up in other areas. So, it seems like a great idea, but it doesn't do anything positive that I know of.
Yeah.
Now, that's just me. I could be stupid. I'm not saying I'm smart. I could be stupid. Check me out too. You go do the research. Go look at the internet. God bless you all. Thank you, Nita.
Thank you, Dr. Darrow, and thank you for your call, Elena. And if you were holding on, so sorry, go to the website and email Dr. Darrow. And I want to thank Alex and Nick and everybody behind the scenes at Living Pain Free. Listen to The Pet Show with our friend Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens. We'll see you next time.